Can you balance for me? Okay, we're just getting started on the left knee. We've already hard. And now we're just checking our image. That looks pretty good. Oh, we're going to do it one more time. Balance. Okay, great. So now we're looking in the medial compartment. This is the medial meniscus. This is the anterior horn of the medial meniscus. Looks good. I'm going to valgus stress on the knee so we can look at the posterior horn. That instrument you see is a shaver. It has suction attached to it. And that's what allows us to clean out the knee and flush it out with basically with salt water. We'll take a probe, please. And as we look back here, the root of the medial meniscus looks good. We're going to probe some of these structures in a minute. Okay, so this is the central part of the knee. This is the cruciate ligament. Normally runs. Yours is torn and absent here. So we're just cleaning out this area. The new ligament, the new graft is going to run just like that metal shaver you see there. It's going to run up in this direction in the knee. So we just want to make sure we can see all the way to the back of the knee here. I'll show you some more in a little bit. Okay, so here's the tear in the meniscus. This is the medial meniscus. You can see the split right here. I don't want to pull it apart, but you can see the split continues all the way up to about there. So we're going to try and table down just a little bit, please. Great. We're going to repair this for you by starting in the back here. And we'll show you some more in a minute. Okay, this is our look in the lateral compartment. That looks pretty good there. We've fixed the medial meniscus. I'll go back and show you that repair in just a second. The lateral meniscus looks like it's in pretty good shape here. Do we have a probe? So a little bit of a split tear in the back it looks like. We're going to explore that a minute. So this is what we're talking about here, this split right here. And that type of tear is a little bit more difficult to deal with. I think we probably need the soterics for that. I think we probably need the soterics for this one here. Okay, so we've got two mattress sutures repairing the medial meniscus. And it's stable as we rotate your knee. Posterior horn, the root is good. Okay, and so now we're going to get ready to fix this lateral meniscal tear also. Okay, so here we've got two sutures in the lateral meniscal tear holding that down, and hopefully that will allow that to heal. We're going to do our PRP at the end through a spinal needle, but now we're ready to get to work on the actual ACL reconstruction. Okay, just want to give you a shot of the graft in position. You can see the shiny fibers running up towards the back of the knee, all the way back there. So as we range your knee, that graft looks like it's in really good position there. I'm real happy with the way that looks. So we're going to finish up here and get you back to the recovery room. The rest of what we have to do, we can't show you on the video. So I just wanted to give you this final look, and we'll get you back to the recovery in just a few minutes. So good luck to you now. I hope this does the trick. Bye-bye.